Chair Burke, Vice Chair Huffman, Ranking Member Antonio, and members of the Senate Health, Human Services, and Medicaid Committee, thank you. Thank you for the opportunity to provide proponent testimony on Senate concurrent resolution, which long overdue would declare that racism is a public health crisis in the state of Ohio, making the state of Ohio the first state in our nation to do this, and appropriately so we should be. I don't want to be remiss by also not thanking the two women that have come before me, our white allies in this space. I think it is highly important that we have white voices in this space, shepherding and shouldering the work that we have before us. I also don't think it is by accident that the two white voices were women. My name is Shannon Isom. I am the president and CEO of the YWCA Dayton, and I'm the president of the Ohio Council of YWCAs. I represent 14 Ohio YWCA associations. That includes 14 YWCA boards and constituents where we have served hundreds, even thousands of women, well over 100 years in this state. And it is driven by a singular mission that we were committed to well before others were not so scared, which is to eliminate racism and empower women and promote peace, justice, freedom, and dignity for all people. And we serve the largest constituency over history of women across this state. We have been at the forefront of the most pressing social movements for well over 160 years, and although we have faltered in that 160 years, we have always been in the forefront, and so we've been waiting on you, and we are glad you're here. We have room for you. We have been on the forefront for voting rights, for civil rights, for affordable housing, to affordable pay equity, for violence within our communities and for prevention of that violence within our families and against women. And we've also been on the forefront for all healthcare reform. So it is appropriate that we are here today to say that we stand in conjunction with this being declared a public health crisis. And we combine our programming as well as our advocacy and our history to generate institutional change. And we do this specifically in 3 areas and always have done it within these areas: in racial justice and civil rights, in empowerment and economic advancement of women and girls, and in health and safety of women and girls as well. Through hundreds and hundreds of years of marginalization that started with slavery, continued and continues with racism and discrimination in this country, it has compounded and delivered poor health and economic outcomes for Black people. It has done that with heart disease, health outcomes, diabetes, and poverty, and in class and education. And these are all being magnified under the current lens of the coronavirus pandemic. It is this legacy of racism that has also led our communities of color, Black communities, to have less trust in all of us, in our institutions, even the public health system, leading to an even poorer health outcome. In Ohio, we've heard this all morning, the highest excess death rates exist for African Americans at every stage in life course, as well as an infant mortality rate for infants, all of non-Hispanic Black women, which is the 8th highest in the nation. It is well known in the public health field that social determinants of health have an outsized influence on our health outcomes. Because our nation's legacy of discrimination and structural racism perpetuates racial disparities, actions must be targeted to address the specific needs of communities of color as we fight for better health outcomes. The YWCA Dayton has dedicated to always thrusting ourselves and our collective power towards the elimination of this racism wherever it exists. And we do this by any means necessary, and we believe that declaring racism as a public health crisis will be a long-term policy response that can outlast this particular moment, that can outlast any particular emotion and redress the wrongs of the past. More importantly, shepherd us into a healthier and more equitable future when our own, from Dayton, beloved Senator Peggy Lehner asked what we can do to make our General Assembly more equitable. I would say that we could have within this also a resounding collective voice from the Assembly to say that this is not a Black people problem, that this in our state and in our country is a white people problem. That in itself would make the space more equitable. As I pause and to conclude, I would, and I've struggled with this, to say a personal story. I was born to parents that in any particular point as teenagers could be written off. They worked very hard and instilled a lot of energy, as well as the generations above me, to do more and to do better, and I have walked that straight line. My mom very quickly moved after she received her degree to Cleveland, where I grew up in North Olmsted and graduated from North Olmsted High School, and my brother and sister graduated from Strongsville High School, which is in Cleveland. Being one of only 3 people in my high school to graduate Black, it was difficult, but I had all access and resources to every single solitary course that I needed to move forward. I went to a national school of excellence. I was on every single solitary committee, not only at school, but at church. I did it. And yet, last summer, when my 19-year-old was driving from Strongsville, Ohio, visiting my family, or our family, and coming back down to Dayton home, she was stopped. And she remembered all the things that I have told my son, who's just 16, but have told him for years on how to stay alive, just in case. And when she was stopped and could not convince, did not understand why she was stopped in Springfield, Ohio, almost home, that she decided to call me because she heard me tell my son that if he ever gets stopped, call me. Just have me on the phone so I can know where you are, so I can listen just in case. So she called me and she said, "Mom, I just need you to listen just in case." And for the first time, I realized that the fear and the generations of tears and scariness that we have for our baby boys, I have for my daughter. She was just 30 minutes from me. And I realized that not only do I have the fear, but I've put it in her, and that has to stop. I've done it all right. I'm in the right class. I go to the right parties. I'm invited to the right things. I know how to speak well. I am palatable. And I am nothing besides a Black mother who has Black children. And I share in the shared experience that we are fearful that not only can our babies die faster within us, but they can die faster outside of us. And that has to be addressed. That has to stop. Our bodies cannot any longer walk around and pretend that we don't manifest our fear and anxiety, that we don't have any power over what happens to our families and our children, and that we have the power to change that. And that has to be addressed. And I don't think you need any more research and numbers and any more Black people telling you this has to stop. I stand collectively, both personally and professionally, in alignment with our mission of the YWCA Dayton that requests that you support the passage of Senate Concurrent Resolution 14 to declare racism as a public health crisis in the state of Ohio and to accept responsibility for the government's role in creating oppressive systems that marginalize Black and brown Americans and proactively work to create a more equitable community for all of us that live here. And at that, I'd be happy to answer any questions.
Very good. Thank you, Ms. Isom, for your testimony. And I want to personally thank you as well for offering your services and that of the YWCA as we expand this conversation to, as you kind of alluded to in your testimony, a process.
Yes.
Right? I always view legislation as a fix, but a process is a cure.
Yes.
And if it's ongoing, then it's consistent forward movement. So, I look forward to seeking your help and learning more and having that process above and beyond the resolution.
Absolutely.
To your question.
Thank you, Senator.
Absolutely. Any questions for the gentlelady? Senator Maharath.
Thank you, Chair, and thank you for your empowering testimony. I'm speechless because me as a woman of color, and just hearing you talk about your daughter's experience. First of all, I didn't even expect you to even have a 19-year-old child. It looks like you just turned 19 yourself. But it resonated with me because this is the same discussion I had with my baby cousins. They're in middle school. They too go to an all-white school, and they just could not understand why there were protests. Why is there a big movement for Black Lives Matter? And I explained to them, look at me. I'm a single mother. I went to college. I'm a state senator, but why am I still struggling? Why am I still living paycheck to paycheck? Why am I still tired? Why am I still living in an apartment? And why did I have to move out of this apartment I really like to get a better education system based on my zip code? It's because of the systematic racism that we have within our system. So I really appreciate you also bringing up women and our allies because of the fact that the previous person before you, Miss Ohio, we were talking about that. I told her about how there's this stereotype of what beautiful looks like, about how people like us aren't considered to be beautiful because we're not blonde, we're not white, we don't have blue eyes, and the fact that you bring up that we need them, I want to ask you, what do you envision then, if we were to have this resolution, what would you envision a relationship with all of us women then, if we were to have this resolution to declare racism as a public health?
Absolutely. The YWCA has been in this space for a very long time, so we are used to having the diversity of women voices across. And so I believe, and I think the YWCA shows it, that we walk with the perspective of the passion and the knowing of what to do, but women and white women, as well as women of color, know how to move the mantle forward because the intersectionality of gender and the things that happen within the perspectives of public health and healthcare itself, we feel. So I believe as we move forward that women's voices are going to be highly important, and I think that white women already know how to bring forward their voices as women from their gender perspective. And I think it is really important, even within their own households, to bring forward their families' voices with this. We know how to do this. I think women know how to stand next to each other. I think we know how to do this.
Very good. Any additional questions? Oh, Senator Lehner.
Chair. Thank you, Shannon, so much for your testimony. I only regret that I didn't hear the very beginning of it. But, it struck me, one of the first things I heard you saying is we don't need more evidence. We don't need to hear from more Black people telling us what's going on. And I'm just sort of struck as I was thinking of what my day is. I was not in here to hear you testify because I was downstairs hearing a bill that I introduced dealing with no longer sentencing kids to prison, minors to life in prison without the opportunity of parole. That 82% of the people who are currently serving life sentences without parole are young Black men.
Yes.
And at the same time, later on today, we're going to be dealing with an education bill that, among other things, is addressing the inequalities that we're facing in our education system, day in and day out. So I absolutely agree with you. We do not need more hearings. We do not need to hear more stories. We need to start acting on what we already know. And if anyone thinks for 1 minute we don't know enough to act, think again. Thank you for being here.
Thank you.
Senator Thomas.
Thank you for your testimony. I tell you, I'm ready to call for a vote.
All right, Senator.
Top that. Goodness. But in all seriousness, you spoke of in your testimony about accepting responsibility. And I took that to mean that not only Ohio accepting the responsibilities for all of the systemic racism that exists in Ohio, but you're basically saying the country, in order for us to move forward, we got to accept responsibility, and then we can begin to turn things around. When someone commits a crime and then they're convicted and they go before the judge and they go for sentencing, the judge want to hear some remorse. Mm-hmm. In other words, want to hear you accept responsibility for your actions. And would you agree that one way that Ohio would be showing that accepting of responsibility and showing the remorse would be by, number one, approving this piece of legislation, as well as removing that horrible language that still creates the option to put someone back into slavery. So would those be methods by which Ohio and maybe the nation could follow suit? Your thoughts on that?
I don't think it is by accident that Ohio, the heart of it all, is first in this. I don't. I know there's a lot of states doing this, but I am hopeful in this space. I believe Ohio knows how to do this and get this right. And declaring racism as a public health crisis, we all know here, would literally catalyze the space. I mean, it would allow voices and tables and committees and bills and legislation and money. It would be a game changer. I think it would also allow us space to not have to hide anymore and speak up front and to be vulnerable and to really do some healing around communities that are not just urban, because I was speaking to the chair that we think this is just an urban issue and only happens in the big cities. This is also a rural issue, and oh my gosh, what that would look like if we decided to talk about racism in rural communities that look like they don't have problems with racism. That would change, I believe, our entire state. I am leaning on that the work that we do at the YWCA of we will empower women and eliminate racism and provide peace, freedom, justice, and dignity for all people has always been centered around hope. I am not only hopeful, I am for certain that we are in a moment that I believe will change everything. I am excited that we know how to be accountable. We know how to put structures in place. And I am also telling you that I have not had a space like this where the diversity of voices and perspectives, the bipartisanship of this issue has ever been readied for us to change it. So yes, I think it's taking accountability, and more than that, I think it is that we are ready, and I have to keep saying that. I think we're ready. I think we're ready.
I grew up in the rural South, Alabama, Appalachian Mountains, 20 miles outside of Birmingham. Racism was alive and well in that area. But I had a stable foundation in terms of my mother, my father, my siblings. We were poor, but we didn't know we were poor because we had everything, clean. My mother washed clothes. What I'm getting at is that there were some statistics I mentioned regarding the young African-American males being sent to the adult court. And in any community or any state or any nation, the root of the stability of that community rests with the family. How strong is that family unit and all of those things. Well, we're dealing with a very difficult situation as a result, in my opinion, of racism, where families are being torn apart, especially African-American families, where men have been put in prison and the women are trying to raise the family. And so one of the additional statistics of that testimony was that once a child is put into an adult prison, within 48 hours, that child is either sexually assaulted or actually raped. And 35% of those individuals commit suicide. Yeah. So that family is being torn apart, and what we should be doing is preventing all of that from occurring by doing whatever we can through those social determinants that are all rooted in racism. Would you agree that if we put our emphasis in those social determinants, would you agree that we may have an impact on this whole issue of what we're talking about now?
I would say, Senator, that without being too trite, I think we could start anywhere and have a social impact because of the amount of confounding variables that come out of the systemic root of racism. I believe, though, the social determinants is an exceptional place to start because of the already intellectual acumen and the readiness. But I believe that we can start we can start anywhere. Yeah, thank you.
Any additional questions? Seeing none, thank you very much for coming up today.